Good morning, clients, patients, friends, and neighbors. If you are watching this video, your pet probably just had surgery, or you are thinking about surgery for your pet and are trying to prepare yourself for what to expect. I would like to break down for you some do's and don'ts for a speedy and safe post-surgical recovery. All of this information should be written in your pet's post-surgical discharge records and told to you by a veterinarian or technician at discharge. But I know it is easy to forget when you arrive. You are probably feeling nervous, excited, maybe even a little frustrated or scared. I'm sure your pet is too. All of these feelings are normal. We are happy that your pet safely completed surgery and now can move on to the aftercare portion of recovery. If you forget anything told to you at your pet's discharge, this video will be a good refresher. Anyway, here we go. Number 1. Do restrict your pet's activity for the full healing time, which is 2 weeks. For dogs, this means leash walk only, no running, jumping, or playing. For cats, this means keep them inside, discourage them from playing or climbing on cat trees, and no jumping on counters like Wonton has done. Number 2, do use the Elizabethan collar or martini cone or cone of shame, as some people say, for the total healing time post-surgically, which is 2 weeks. In some cases, there are alternatives such as a bodysuit you can buy or an inflatable neck brace to prevent head movement, but these are not suitable for all cases. For dental surgery, sometimes a cone is not needed. Number 3, do follow all instructions on the medications dispensed by the veterinarian. If you don't know when to start the medication, look on the label. It's usually written. If not written, ask. Number 4, do feed the evening after surgery, but remember, a smaller than normal portion is advised. Give water as normal. Number 5, do remember, your pet just had surgery and might be sedated. Please try to get your pet to a warm, comfortable, quiet place the night of the discharge so they can rest and heal. And finally, number 6, because I couldn't squeeze these rules into 5 bullet points, do ask when you need to return. In many cases, we put absorbable stitches in the skin or mouth. In some cases, non-absorbable suture is better, and those need to be taken out by a veterinarian, typically 2 weeks after the procedure. Usually we perform the suture removal in 2 weeks at no charge, and even if there are no stitches that need to be taken out, we gladly schedule a brief complimentary recheck with a surgical technician or the doctor who performed the surgery. And now for the do nots. Number 1, do not feed your pet the morning of surgery. And in most cases, you should take away food when you go to bed the night before. Number 2, do not allow your pet to lick or chew at the surgery sites. Number 3, do not let your pet be very active for 2 weeks post-operatively. That means no marathons for anybody who is thinking about doing one. Number 4, do not discontinue the medication without calling us or finishing the full directed course. And number 5, which is probably the most important, do not panic. Expect that the 2 weeks after surgery is a recovery time, but it is a small period of time in the grand scheme of things. Your pet will be fine, and we are here to help you with any complications that arise.